Hello everyone, welcome to the Smart RN channel. My name is Henry. Today we are going to start a series of videos on the cardiovascular system. And in these videos, we are going to look at the conditions that affect the cardiovascular system and the role played by nurses when caring for patients with cardiovascular conditions. In this video, we are going to start by looking at the anatomy of the heart. So let's get started. The heart is a fist-sized hollow organ found in the thoracic cavity. The heart is a fist-sized organ, and it is found in that space that lies in between the lungs. The heart is enclosed in a protective sac referred to as the pericardium. This pericardium consists of two layers. We have the parietal pericardium and the visceral pericardium. The parietal pericardium is the topmost layer of the pericardium, and it is very tough and fibrous. It is tough and fibrous because it provides protection to this particular heart. The visceral pericardium is the inner layer of the pericardium that lies directly on the surface of the heart. Between the parietal pericardium and the visceral pericardium, we have got a space or a cavity referred to as the parietal cavity. This space or this cavity is filled with serous fluid, which provides lubrication and reduces friction as the heart pumps blood throughout the body. The heart is a muscle, and it is made up of three layers. We have the topmost layer referred to as the epicardium, the middle layer referred to as the myocardium, and the inner layer referred to as the endocardium. The epicardium is that layer that is continuous with the inner layer of the pericardium. And when you talk of the inner layer of the pericardium, we are talking of the visceral pericardium, that layer that lies directly on the heart surface. So it is continuous with the epicardium. The myocardium is the layer of the heart muscle that provides contraction as the heart contracts to pump blood throughout the body. The endocardium, on its part, is the layer that is continuous with the valves which are found within the heart. The heart is made up of four chambers. We have the top chambers referred to as the left and right atrium, and the lower chambers referred to as the left and right ventricles. So if you look at the heart here, these two chambers are referred as the atria. So we have the right atria and the left atria. And these bottom ones are referred to as the ventricles. We have the right ventricle and the left ventricle. Now, one thing you have to note about the ventricles is that the walls of the left ventricle are thicker when compared to the walls of the right ventricle. And the reason for this is that the left ventricle has the work or the function of pumping blood to the rest of the body. So it pumps blood to the whole body. Whereas the right ventricle only pumps blood to the lungs for oxygenation. So that's why the walls of the left ventricle are thicker when compared to the walls of the right ventricle. Now, as I said earlier, the heart is made up of valves, and there are two sets of valves in the heart. We have the atrioventricular valves or the AV valves and the semilunar valves. The atrioventricular valves are those valves which separate the atria from the ventricles. And the semilunar valves are those ones which are located at the entrances of the blood vessels that originate from the heart. So on our diagram here, I just said that the AV valves are between the atria and the ventricles. So between the right atrium and the right ventricle, we have a valve referred to as the tricuspid valve. And between the left atrium and the left ventricle, we have a valve referred to as the mitral valve or the bicuspid valve. At the entrance of the blood vessels, at the entrance of the pulmonary artery, we have the pulmonary or the pulmonary valve, and at the entrance of the aorta, we have the aortic valves. The purpose of these valves is to ensure that blood flows only in one direction as it goes through the heart. In other words, these valves prevent the backflow of blood while it is flowing through the heart. So the valves control the blood so that it only flows in one particular direction. Now, if we look at the flow of blood within the heart, the blood enters the heart through the right atrium. Then from the right atrium, it goes into the right ventricle. From the right ventricle, it goes into the pulmonary artery so that it can transfer blood to the lungs for oxygenation. Now, while in the lungs, the blood is oxygenated and begins to flow back to the heart via the pulmonary vein. From the pulmonary vein, it enters the heart via the left atrium. From the left atrium, it goes into the left ventricle. Then from the left ventricle, it goes into the aorta, from where it goes to the rest of the body to supply oxygen and nutrients to the parts of the body. And once it becomes deoxygenated, it begins the journey back to come to the heart so that it can go to the lungs and be oxygenated. So the blood enters the heart via the right atrium here. So remember, we have the superior vena cava, the inferior vena cava. They all bring their blood into the right atrium. Then via when the tricuspid valves open, the blood flows into the right ventricle. When the right ventricle contracts, the pulmonic valves open for blood to flow into the pulmonary artery to be carried to the lungs for oxygenation. Once the blood has been oxygenated, it enters the pulmonary vein so that it is brought into the left atrium. Then once the left atrium, the mitral valve or the bicuspid valves open for the blood to flow into the left ventricle. And when the left ventricle contracts, this blood, the aortic valves open and the blood flows into the aorta to be carried to the rest of the body. Now, I want you to remember one thing, that the valves in the heart open and close in response to pressure changes within the ventricles. The pressure changes in the ventricles will cause the valves either to open or to close so as to regulate the flow of blood through the heart. And let's see how that happens. Now, when the heart is in resting mode, we say the heart is in diastole. In other words, in this mode, the blood flows into the ventricles, or the ventricles fill with blood. So in diastole, the heart is resting, is resting mode. So blood is flowing from the atrium to the ventricles. Now, when the pressure is very low, the mitral valves open, the tricuspid valves open for blood to flow from the atrium to the ventricles. When the pressure builds up in these particular ventricles, it forces the mitral valve and the tricuspid valves to close, and when the heart pumps the blood, or when the ventricles contract, they force the pulmonic valve and the aortic valves to open so that blood can flow through the pulmonary artery to the lungs and through the aorta to the rest of the body. So the pressure changes within the ventricles is the one that is forcing these particular valves to open and close. So remember one thing, that when the tricuspid and mitral valves are open, the pulmonary and aortic valves are closed. When the pulmonary and aortic valves are open, the tricuspid and mitral valves are closed. So that's how they actually operate to control the flow of blood through this particular heart. Now, There are two terms I want us to look at here. There is systole and diastole. So systole is that phase of the heart when it contracts. So when the heart contracts to pump blood, we say it is in systole phase. When the heart is resting, that means when the ventricles are filling with the blood and the heart is in rest mode, we say that it is in diastole. So systole is when the heart contracts to pump blood, and diastole is the heart is actually resting so that blood can flow or fill into this particular ventricle. Now, another thing we have to understand is that the heart beats for a lifetime. In other words, the heart begins to beat when one is born and will continue doing so faithfully until end of life. And it beats every day by an average of between 60 to 100 beats per minute for the whole of somebody's lifetime. So that's the work that the heart actually does to be able to pump blood to the various parts of the body, to supply oxygen, to supply the nutrients, and also to clear the waste from various parts of the body so that can be transferred to the various parts of the body from where these waste are cleared from the body. So that brings us to the end of this particular video on the anatomy of the heart. Just remember to drop a comment. Remember to subscribe to this channel, like this video, and also share this video. Until next time, from me here is goodbye.